The camaraderie that you get from the people on the course, I think, is second to none, because you're all in the same boat. It's been a lifeline to me.
The Thinking Ahead programme is specifically a programme for people with incurable cancer. So the ultimate aim really is to encourage people to think ahead and to have difficult conversations really about end of life, but with the view of getting things sorted, getting prepared, knowing what's going to happen and who's going to be there to contact people.
The Thinking Ahead programme at the moment is virtual. We run that via Microsoft Teams. So we have 2 patients on the virtual Thinking Ahead programme, Karen and Kathy. They got along really, really well on the programme and they're actually meeting today for the first time.
Hiya, lovey.
Hello.
Hi.
Oh gosh.
Kathy and I bonded really pretty much the first time we were on the course. We bonded in as far as the fact that when we were saying stuff, we said, oh, that's just what I was thinking. And it's also the scare and the rawness of it, knowing that we're both scared to death of what might happen.
I didn't join the course thinking that I would make any friendships, but there's something special about meeting somebody who is going through what you're going through. That friendship that developed has helped me enormously.
The Thinking Ahead programme is really wide-ranging, so we have a talk from a benefits advisor, from an estates planner, from a psychologist about managing uncertainty, which is a massive issue for people affected by cancer. We have a chaplain who talks about faith and spirituality, and then we have a couple of key sessions with palliative teams, and that's around managing progression and managing symptoms like pain and chronic fatigue.
A lot of the topics can be quite emotive, so you do deal with really difficult subjects. So initially we have an introductory session. In that you discuss the confidentiality agreement and also just reinforcing the fact that you don't have to share everything if you don't want to share it. And we will always make sure that we make follow-up calls if there's any concerns.
The things that were beneficial to me and what had an effect on me was end-of-life care. It's not something you tend to talk about when you're fit and well, and suddenly you have to think about that. It upset me, it made me talk about it. I would not have approached it without the help of the lovely people that I could talk to.
Certainly within the course, I would say that I've gained knowledge that without that knowledge it would be even tougher than what it is going to be facing the future. But I think the overall is the support that you get, and it's not just on the course, it's when you're finished.
The feedback from all of the Thinking Ahead courses that we've run has been consistently excellent, and actually every patient and every family member who's joined has said they did not want to do it, but looking back they're so glad that they did.
Kath's diagnosis, it came very quickly and there was lots of things happening. We do most things together, so she mentioned the programme and she wanted to do it, and it was really nice to see her developing relationships with other people and professionals and asking the questions without being prompted or encouraged by me. And I think there are issues that we would not have thought about if we hadn't gone on this programme.
Certainly when you look at the Thinking Ahead subjects, they're not the subjects that you're going to think, oh, that's going to be a laugh or that's going to be exciting. It's really tough to face some of it, but I would say it's invaluable to face a lot of the things, because once you've actually realised some of it's not as scary as what you really think.
If you can put those worries on one side that are really troubling you and have some experts say this is how we can deal with it and we'll help you to do it, it takes away the fear of what it might be like at the end, and that has helped me enormously.
From Kath taking part in the programme, I've seen that on the days that the programme's taking place, that she's looked forward to it, and every time I talk to the Macmillan people they always say, we're there for you as well, you know, Peter, it's not just for Kath. So I do feel that I get support.
I can't really think of anything that I don't like about the course. I mean, the Thinking Ahead course is so well put together. So much of a cancer diagnosis is mental. I think as long as you've got people to talk to, you can get away with that. And that's where the course definitely comes in, somebody to talk to.
I want to take one day at a time, and I feel I'm getting closer to being able to do that now than I would have had I have not been on this course. It doesn't take away what's going to happen to you. That's inevitable, but it makes the journey to the end a little bit easier.